Greetings, everyone. Welcome to Talk, Therapy, and Heal, where we talk about life's challenges and traumas. Welcome back, and we look forward to connecting with you.
Hello, I'm Kenya, licensed professional counselor associate supervised by Miss Unica Willis.
Hi, I'm Rachel Logan, a licensed clinical social worker.
Hello, I'm Larisha Perlow, a licensed marriage and family therapist.
Hey y'all, and I am Yanika Willis, licensed professional counselor, supervisor.
Hello, my name is Chantrell King. I'm a licensed professional counselor, associate supervised by Miss Unica Willis. So this morning, or this show rather, if you will, what we are going to be talking about is surviving trauma and dysfunction. Okay. Now we're continuing on with our series, and our series is the Family Ties series. That's what we're going to be coming from with that series for the next few shows, I guess you can say, with our topic being surviving trauma and dysfunction. So we really want to break this thing down so you all really get an understanding. And the hopes is by the time we're done, that something will just awaken in you that you will want to go get the help that you need.
Yeah. So let's define trauma.
Yeah.
Okay.
Yeah.
So I have a couple of definitions. One, this is just from Google. It is a deeply distressing or disturbing experience.
Okay.
Emotional shock following a stressful event associated with physical shock and sometimes leads to long-term distress.
Okay.
Okay, so DSM-5.
Okay.
Okay, is an exposure to one or more traumatic events, which is defined as one that involved death or threatened death, actual or threatened serious injury, or actual or threatened sexual violence. And I want to just add here that it could be one that you personally experienced or you witnessed.
Absolutely. That's
Yes.
good.
Should we tell everyone what the DSM-5 is?
Yes.
Yes.
Go
What
for
is
it,
the DSM-5? So the DSM-5 is a manual, if you will, that is used in the therapy or the counselor world that has all the diagnoses that has been discovered and studied over time. They compile them all in this manual for us so that we have a better understanding of what it is and what it means to have that diagnosis. So if you don't know what it is, you can Google it. Don't get me into the whole term of what the DSM stand for, Diagnostic Statistical Manual. No.
It's fine.
Yes, 5. And 5 is just, 5 TR because, and those ending letters or numbers and words are just when they update it. So it started off from a lower number, of course. So as they continue to put things in, as things are continue to be discovered, it's added to the DSM, and then they just create a new manual. So there you go. Thank you, Rachel, for those definitions.
Right. So did we want to continue on with what you was talking about before we came on?
So we are, like Shan said earlier, we're talking about surviving and recovering from trauma and dysfunction. And so Rachel gave you all a definition of what trauma means from Google perspective, from the dictionary. I don't want to say Google because it's the dictionary. And the DSM-5. And so we've just been having different conversations about trauma and what it means to an individual. And so we've all experienced trauma in some sort, some form, some type of way. Like she said, with the definition or defining it, it doesn't necessarily have to be your trauma, right? It can be someone else's trauma. You watch someone die. You watch someone be in a car accident. You watch someone. I don't know. What are some of the other things that we see?
Domestic violence.
Oh yeah, that's a big
big
one.
one.
Yeah.
That's a big one. Domestic violence. So watching as well as experiencing. And so we just want to come to y'all today and just give you some pointers, some tips, some things on what it really means and how you can deal with it, like cope with it and get the help that you need from it. So the first thing that I think I wanted to bring up was sometimes people tend to deny
Yes.
that they,
That
they've
is true.
experienced trauma,
Yeah.
and most of the time it's not necessarily an outright denial. It's that it was normal
Right.
to them, right?
Right.
It was normalized. So
Mm-hmm.
you saw your mom get beat by your dad every day, and so then you saw somebody else get beat. You're like, oh, that ain't nothing.
Right.
Yeah.
That's normal,
Right.
Yeah,
Right.
that's normal. It's a normal occurrence. You getting cursed out every day, mental abuse, right? All of those things, and we normalize it, especially in a lot of different communities. It is normalized, and so we want to kind of help you understand that trauma is affecting you and how it's affecting you, how you're
Right.
showing up, like what do you do, how you respond to things, how you respond to people, how you handle stress, if you even understand what stress is, the anxiety of things, being depressed. I mean, it causes so much deep emotion that it's a lot to deal with. So what are y'all thoughts of I guess clients that you've come across, how trauma has affected them, or even ourselves? Because like I said, we've all experienced trauma of some sort.
Yeah. I would say most utilize it as a defensive, you know what I mean, mechanism. An example I could give would be if it was family related, let's just say a parent wasn't there or wasn't available. So that child grows up feeling and believing that there's nobody there. So then they create, or not they create, but then they experience maybe independence. You know what I mean? A more profound independence to where they don't depend on anybody, where they can't relate, where they can't connect with anybody, because in childhood, you know what I mean, that connection was broken, was severed. And so they're bringing that, into their adulthood. But it's a defensive mechanism, protective measure.
Wow.
And it shouldn't be, but sometimes that's what happens.
Yeah. What about when and a lot of times kids do this, or people do this as children, they disassociate to come away from what they're experiencing, the trauma. And so what that looks like when they become adults is isolation.
Yes.
Right. So they begin to isolate themselves from other people and say, well, that's just who I am. I don't like being around people. But it's like you said, a defense mechanism.
Protective,
You're protecting yourself. And so we see that a lot. I guess I want to know, what is your thoughts like with people who experience that with kids? Like, how can it be recognized? Especially for those who have children, like how can they begin to recognize that?
That's a good one. And I think that's something that we really have to go really deep on. This is something that my wife and I have talked about a lot, especially when it comes to children. Believe it or not, sometimes children know when something is wrong. They may not understand the trauma or the dysfunction, but they know that something occurred, something happened, something's not going right the way that it should be going. At that point, I think parents have to pay more attention, because there have been a lot of individuals, kids, that have went and told their parents, Mom, I've been traumatized by this person. They did, oh no, they wouldn't do that to you. And so right off of the bat, there's rejection, there's unbelief. I'm your child and I'm telling you something's wrong and you're not believing me. So now they start to harbor that. And then what that does is, if that parent doesn't believe them, then they start to think it's okay. So now here comes the dysfunction. And what you have to do is you have to address that as early as you possibly can, so that maybe that person can heal from that. Because this is what I see has happened with a lot of people I've seen, is that they're traumatized as a child. They never do anything with it. Then they marry somebody that was traumatized as a child. They never did anything with it. Now both of that traumatizing and that trauma has now clashing in their relationship. Now marriages are all out of whack. And so we have to get to that point where, if a person believes that they're being traumatized, you meet them where they're at until they're able to potentially work through that.
Right? Like for years, like 2 years, they didn't go to school. They didn't go outside. They couldn't get close to anybody.
Yeah. Everybody running around with masks on their face. You don't know who robbing you and who ain't.
Come on, right? I mean, but I'm just thinking about the importance of, like, walking and talking to your children.
Mhm.
Because
Yes.
if we don't and it's just brushed over, they're harboring those feelings.
Mhm.
And so now, like, who can I trust? Who can I talk to? It's just a whole bunch of things that kind of come up in my mind when I think about, man, like how this period in life has impacted our children. Like, we talk about what it was like for us as business owners, as leaders, as a community, but what about the children?
Yeah.
Right.
Right.
You know, I was sitting up. Oh, I'm sorry. Okay. So I was sitting up thinking about this and I wrote this down. When it comes to trauma, the best way I can sum it up is like this. When a child or a person experience and I put this in the frame of a child, when they're experiencing trauma, it stunts their growth and freezes it at that age mentally.
Yes.
But
Mhm.
physically, you still growing up. I'm a whole grown person, but your mind is stuck at the 8-year-old.
Mhm.
Whatever you experienced, whatever you went through. And then I was sitting up thinking about, as you were speaking about the children, if we can be honest, because I like to bring it to present day. Well, during that time, the pandemic, right before that, it was a bunch of rioting. It was a bunch of individuals getting murdered. I know we had to sit down and check in with our children. How do you feel about this? Because the thing is, we didn't have Google and YouTube and all these social medias where we were that accessible to it. But oftentimes, because we started the conversation with our children, they will come to us and show us things. But a lot of times we can get so busy as adults that I agree, we don't sit down and check in with our children. Makes that thing a habit. What did you expect? School shootings.
Yes.
That's a big thing that's traumatic for children. We were hiding under books trying to protect us from tornadoes. I'm from Oklahoma, Tornado Alley. These kids are having to get backpacks that's made of armor dang near just to protect them if somebody come into school shooting.
Mhm.
So not only allowing your child, okay, what did you experience talking to them, but if they're expressing anxiety, number one thing, if they're expressing depression, I don't want to go back to school, isolation, what are the parents doing? Hey, I need to go give my child some help. That's what I would think as a parent. I mean, I have 5 of them, just like I would if, God forbid, you just broke your knee. We got to get you some help stat, So that was kind of what was on my mind as you said that.
You know what I think of? The one word that comes to mind when people talk about trauma and kids experiencing trauma, kids are resilient.
Yeah. They'll bounce back. They'll be all right.
Yeah,
Yeah.
they'll be okay. I went through that and look how I turned out.
Okay.
trauma-free.
Right.
Good example.
Yeah.
Yeah.
So what do y'all think about that? When we think about resiliency in children, and then when it's not addressed as a child, and that thought process goes into them becoming adults, and they become an adult who is, like I said, trauma filled.
Mhm.
What's your thoughts on that?
I think people use that word resiliency a little loose. Because you can be very resilient, and what we have to understand is you can be traumatized by something, and then that same thing can occur again, and it kind of gives you a setback. A good example that I use where I work at is that when it comes to kids nowadays, when we went to school, you can have a fight with somebody, and then you would dust each other off. Y'all were probably best friends after that. Nowadays, when they have a fight, the cell phones come out. And it's the video that is posted on YouTube, TikTok, you name it, it's out there. And so that child that, as we used to say, got dusted off, the one that got beat in the fight, it is posted all over social media.
Right.
And they have to see that day in and day out. So now the parents come forth and say, hey, Yahoo, whoever, y'all need to take that down. Okay, they take it down. But that child got beat down when they were 10. It pops back up when they're 14. It pops back up when they're 18, 24, 32. Because of the internet nowadays, they never get over that. And if they do get to a point where they're dealing with it, now they're being re-traumatized over and over and over again.
I love that you say that, and I teach about how the body keeps the score, and there's a book out there about how the body keeps the score. So when we are re-traumatized, your body doesn't know to respond in the new situation. It responds from the old, and so we're thinking about. So our brains, and I wish I had the book here to show y'all, because I use this kid book with my adult clients that shows how the brain is set up, and that we have our hippocampus, right? We have It stores all of our information. It stores all the memory, all the things we've ever experienced. Our brains are kind of like computers. They don't get wiped clean because you're no longer experiencing that thing.
Yeah.
It remembers it. And so it brings it forward. It first goes to the amygdala where it processes it and tells you what to do, how to respond, how to react. And so most people are stuck in that amygdala. It never comes forward into the prefrontal cortex where you actually process and make rational decisions, right? So a lot of adults, because they've had childhood trauma, when they experience it at 32 and it happened at 8, they respond like an 8-year-old.
Of course.
And that's from that imprint that the
Absolutely.
mind goes back and says, oh, remember how you responded then and this time, because it remembers the first experience. That's the first imprint. It remembers that and pulls back from that. So how do you then take that and say, you know what, I need to make sure that this information is getting past the amygdala and getting into the prefrontal cortex. So I told this is where we do techniques like grounding.
Yes.
We're mindful of where we are and what's happening in the right here, right now. And you're kind of testing that information to what's taking place right now so that it can process into that prefrontal cortex and you make a rational decision. But the problem is most adults don't know how to bring it forth into that prefrontal cortex. They're stuck in the amygdala. So they're always constantly reacting.
You're absolutely right. And I'll just be open and honest. I've experienced that while I was in the military. And my wife would tell you that when I first got back from Iraq, I knew I wasn't right. And she knew it, but I was just, I'm a soldier. I got to lead these troops. Everything's going to be all right. But she would tell you, I used to drive down the highway, and if I saw like some trash blow across the road, a blowed out tire, I could take my eye off of the road and look at that tire thinking that's a roadside bomb and still be driving. And my kids like, Daddy, you ain't looking at the road. Yeah, I am. I see, and I can see exactly where I'm going. But every time that would happen, I would go back to that. And when I started to get counseling, my therapist was like, first and foremost, you have to realize, where are you at right now? And so I'm in the United States. And he was like, yeah, you ain't in Iraq anymore. Do people walk around putting roadside bombs? No, they don't. But no buts. You have to realize where you are. And I had to start accepting that. Now I got a lot better. But you're absolutely right. Every once in a while, we'll be driving and I'll look up on the bridge and somebody's walking up there. I'm going to hit them brakes. I'm going to think. But I have to think about where I'm at. Then I can go on. So I can definitely understand that, having experienced that, how that snaps you back to that trauma that you first experienced.
Wow, that's a good example. I'm gonna speak, of course, because relational, that's what I do, and generational curses. Being that that's my focus, we do not understand how much we allow to flow through us. And I want to throw it to Rachel after this because it made me think about. Let me speak about generational curses and trauma. A lot of saints, let me speak to the saints, believe that, and I don't believe this, but the saints believe, well, once Jesus came, the curses were lifted off. We no longer go through that or whatever. I give it to Jesus. I do. I'm not discounting nothing that Jesus did. The thing is, I don't believe we understand that we allow, because we didn't renew our minds, as the word of God tells us, we allow things to flow through us and to continue on to the next generation, to continue on to our children. And Nikki, you were speaking earlier. One of the examples I was sharing before we came on is that I heard it so often. Let's think about, for example, sexual abuse, right? Someone has been sexually abused. And I've literally heard a mother say, well, I went through that, so my daughter will be fine. They don't need help. I don't need to go get them, whatever. You're allowing that to pass through you to that child. You may have dealt with it by not really dealing with it, which means you ain't dealt with it. My country came out. But you cannot project that same thing onto your child, because these children this day and age, and I'm not speaking this, but I'm just speaking fact, will jump straight to suicide.
Yeah.
They will jump straight to it. One of the things I know, growing up in the Baptist church, when I was coming up, we was always taught, well, according to the word of God is wrong and you don't do it. So you were scared of burning in hell. These kids, a lot of them are not in church or whatever the case may be. So they will go straight to that thought. So I say that to say, please, as a parent, if you have went through any traumatic experiences and you haven't dealt with it, number one, I highly encourage you to deal with it. Go seek some help. Go get you some help. If you can't go to your church or your pastor, whatever, go get you some help. But please don't, if you don't know how to deal with it, at least for the sake of your child, because we're responsible as parents for our children. Go get that baby some help. And then while the baby is getting help, I call everybody's children babies. I don't care if they're grown. But while the child is getting help, do not please criticize them of, oh, you think you better, because no, they're working through their trauma. So throwing it to you, Rachel.
Hold on.
Oh, go
Before
ahead.
you
Okay.
Go ahead.
because I feel like this is where this need to be put
Okay.
in here, and is that you cannot heal or be delivered
Come
from
on.
what you will not confront.
Whoa.
So
Say that
Yes.
one more time for the people.
you
Yes.
cannot heal or be delivered from what you will not confront.
Look, snaps and all of that. So with Rachel, what I was just speaking about when it comes to, and even I've, heard this as well. Well, I got God, I got Jesus. I don't have to worry about. And it's funny because I think about Pastor, one of our old bishops. I'm sorry, I'm being tempted, but it's in my head. I got to get it out. And he was talking about, he was military in a military rucksack. And he came down the aisle with the rucksack on his back. And he was saying how people come down and you get the prayer and all the things. You put the rucksack down, but you pick it back up, put it back on, and take it back out. So can you speak to those who, I got Jesus, I got God, I don't need, I went through this. But we as trained professionals can tell.
Yeah.
Even their spouses can tell, their children can tell, because you're barking at them like a drill sergeant that you got issues, but they say, I got Jesus.
Yeah.
I got God.
Yeah. It's interesting. You are both human and spirit.
Come on.
So you have to separate the two, right? In that, yes, we know facts. Jesus saved, he healed, he delivered, but we have a humanistic responsibility to take care of ourselves, right? To walk through the process of healing and deliverance. So I brought up the definition. Healing means the process of making or becoming sound or healthy again.
Say that one more time for me.
The process of making or becoming sound or healthy again. That means you were at one point healthy, something happened, and so now we got to walk through this process of becoming healthy again. So that's a human responsibility. That's not a spirit issue, right? Jesus already delivered. That means we got to do some work. We have to take time and confront what occurred, what caused me to no longer be healthy, or because you got to think a disorder or dis-ease is something that causes us to no longer be easy, right? To be at ease anymore.
Absolutely.
It's dis-ease. So deliverance is this though. The action. Listen to these words.
Yeah.
The action of being rescued or set free.
That's
There's
good.
an action. There's something that we have to do.
Yes.
So while it's releasing what happened, right? So no longer holding on to things, but we got to release it. That's the action.
That's good.
And come on, what is the action? Forgiveness.
Forgiveness.
Yes.
Moving forward.
That's the action. Go
That's
ahead.
a big word.
Yeah.
That is a big word. Forgive. I'll hold your own forgiveness. And maybe we'll have to separate that. Because forgiveness is when you speak of that, even for myself, to say that I'm going to truly forgive somebody, you asking me to kind of go. You want me to go run a marathon. You want me to go and jump in the pool and swim for 5 miles. You want me to do a whole lot when you say forgive, because when we're talking about release, like you said, Rachel, releasing something that's within you, a lot of times we feel comfortable or we get comfortable with how we feel in a thing. And what I need to change for. Right. I don't want to change. I don't need to change. I ain't do nothing wrong. I'm good. But you're holding on to that. And like you said, it causes that dis-ease, but disease in the body, which is how you end up with high blood pressure. You end up with diabetes, ulcers, and cancer, and all
Anxiety and all that.
all of the things. It manifests. It starts to manifest in your body and create all of these discomforts in your body because you won't confront.
Absolutely. And I like how we're really going into this, but when we're talking about surviving trauma and dysfunction, it's hard to survive when you're feeding only death into your life. It's hard to do that. Now I want to do this really quick. I want to get Rachel to give me that the definition of deliverance once again.
One
Okay.
more time.
The action of being rescued or set free.
Rescued or set free. I don't know a lot of people who get kidnapped, who get enslaved, and then get set free and then turn around and go back. We have to learn how to quit picking the scab. Oftentimes when we start that healing process, because of the trauma that we have been through, we would go diddle around in that same trauma and it does something to us again.
Yes.
You know that when you went to that club and you got sexually assaulted, why would you go back there knowing the same people, the same atmosphere and all that stuff is going in? So a part of healing from that, surviving that trauma, you've already survived it. Now the healing has to take place. And we don't want you to survive. We want you to thrive.
Let me say something right
Yes.
Yo. Why?
Break it down.
I just thought about, so I want to throw this to the relational coaches and experts here. Why do we do this in relationships? Why do we do that, right? Like if the person on the other side is not willing to correct their behavior or to fix, whatever the issue is, right? Like, so I think about domestic violence. We get, right, what you just said, like, okay, something occurred. We get rescued or set free, but then we re-trigger ourselves. Like we do it at that point. If we decide to go back and the other person's not willing to fix their behavior.
Yeah.
Oh, I'm so sorry. Because I feel like this is relational. It's relational, but it's identity.
Yes.
Yeah.
It's identity.
It's all
It's
relational.
wrong. You don't know who you are.
There you go.
That's why you go back. That's
Why
the
you go
trauma.
back. You go back because they have defined you and told you what you are, who you are, what you are, what you will become, and you come to believe it.
Yeah.
So you go back because nobody has ever told you anything different.
Different.
So then your
Absolutely.
identity become victim.
Yes.
Wow.
Then you become,
Victimization.
yes, and then you become and that mindset, that behavior, man. Whew,
And
how
sometimes,
set free.
sometimes that dysfunction becomes comfortable with people. And
Because you might not know anything else.
you may not know anything else. And so you sit in there and say, well, this is the way I'm supposed to be. This is the way it's supposed to go for me. I'll never be anything but this. You got to learn that God did not purpose for you to be in that situation all the time. If not, he wouldn't have healed the woman with the issue of blood, the person at the pool of Bethesda. It's just so much more that you have to want for yourself, but you got to want it for yourself.
I just want y'all to acknowledge something. Did you notice his body language? When he said, "Oh, this is me," he sunk down.
Yeah, he shrunk
But
back.
then when he said, "No, my identity,"
Yeah.
He stood up.
let's look at this body. It matters.
Yes, it does.
matters.
Yes.
Okay, go ahead.
Yeah.
But what I was going to say too is the fact that that's what we know.
Yes.
That is what we know. That's what we know. So we'll continue to go back. And then even when we go and get the help, because it's such unfamiliar territory, we'll say, oh, it's easier to go back to this than to continue to press forward to deal with that or whatever. So that's one thing when it comes to relationship. But then I was thinking about this as you was talking now. It's still relational, but I don't mean to change the topic or change the subject slightly. What I don't understand from a relational point of view, that being in a relationship, it may be something, let's go back to generational, that my mama did. My daddy abandoned me, wasn't there. My mama treated me like I was the son husband. Y'all not ready for that one. That's going to be a hard show. Okay. My mama treated me like I was the son husband. I was the oldest child, so I was made to be responsible for my siblings. I never could be a child. I had to grow up. It's on my head, but I forgot what it's called. Where you have to grow up quick. Parentification, I believe it is. You have to grow up quick. And so with all of that, in some cultures, we were taught that if you go and you ask questions, you sassing, you being disrespectful, or that's my business. Why you asking? No, I just want to know why my daddy wasn't here. Why didn't my mama leave me with my grandma? So what I'll do is I'll get into a relationship. I got all this bottled up, and guess who I take it out on? The person I'm in a relationship, but I don't have no problems. And somebody had mentioned when we was doing the last show about that box, we just put it away in a box. So we disassociate from it, or we say, oh, that's in the past. But your body is manifesting and acting out with that which you're still in bondage in your mind because you're stuck at your 7-year-old self or your 8-year-old self. So go get the help process so you won't do like Nikki was saying, acting like an 8-year-old, throwing a temper tantrum in the middle of Walmart, no offense, you know what I'm saying? We've seen that happen. Or whatever, you're throwing a whole temper tantrum as an adult.
Yes.
I'm not trying to minimize anybody when I say this, but you'll pick up, we all real, but baby, I'm right here with it. You see what I'm saying? Is the fact that when we set up and do that as an adult, especially when we have children, next generation, that could be really embarrassing. So to go to counseling, I'm disclosing myself. I used to be the one anger. My childhood was coming out from, so that's why I can say what I said. My mind was stuck at a 5-year-old. Even though I was going to fight, cuss you out. Oh, don't cut me off on the highway. Not in Texas. What? You know what I'm saying? It's going down. But our adult bodies is met. I'm acting a fool with my coworkers at the job, and they can't understand why I got to come in with an attitude every day. And then is it me? No, it's not you, sis, bruh, coworker, whoever you are. It's the person. So I encourage you to go get the help that you need because of that bondage. You break free. And no matter, and I'm gonna tell you, and I'm not trying to preach because some of you don't let go. The enemy is gonna bring you and continuously try to bring you back to where you were and test you over and over again. But when you get the healing, you do the work, you put in the work, then you can recognize those things which are commonly known as triggers.
That's right.
It was in me. Okay, but
I was just gonna say, I hear it, and I definitely hear from the spiritual perspective, but it's a familiar spirit. It's what's been happening and what's been translated from generation to generation. It's familiar. It's comfortable. It's what I know. It's the norm, right? So that familiar spirit. How do you break that? How do you move from that? You know what I mean? We are, in this world, but not of this world, right?
Right.
But how do we break that? That familiar spirit.
I think one of the first things that we have to do is we have to have the conversation about the trauma or the dysfunction that we have experienced. And when we do that, we have to do that with the right person. Most individuals who have experienced some trauma or going through some type of dysfunction, they want to be validated. So once you validate that individual, you find someone that can validate you, I think it's important that you move forward and you seek some type of professional help to help walk with you in that journey. Someone who is going to be beside you that may understand what that is like and can guide you in the direction that you need to go. Then once you get that professional help, and a part of doing that is doing the work. It's just like Rachel said, you got to put some action behind it. If the ball is rolling down the hill, you can keep rolling up the hill all you want to. Until you put a stopper behind it, it's going to keep going down to the bottom and you're starting all over again. So you have to be able to do that work. And a lot of times that includes making a connection with an individual. You may have to link in with a professional group where other individuals may have experienced that same thing. And you talk that out. You see that you're not by yourself. You see that other people have gotten over that. And it would be helpful to hear those experiences so it can give you some oomph, if you will. It can kind of motivate you to say, well, if that person did it, maybe I'll be able to get through it. If nobody didn't believe me, maybe that person will believe me. And then the next thing I believe that you have to do is you have to refuse to inherit dysfunction and further trauma. Don't inherit it again.
Oh, that's big. I like that you said that, and I know y'all gonna hit that from a relational and even hit it from a spiritual point. But when you were talking about seeking the help, the one thing that came to my mind is when y'all are seeking a therapist, when you are out here interviewing us, because you should be interviewing us. Yes, you need to make sure that we're a good fit for you.
Yes.
Don't get in no therapeutic relationship with a therapist and they and nod you on and everything and all your dysfunction and don't call it out. Because not in a confrontational way, but make sure somebody can meet you where you are. Make sure that they can help you through your stuff. And I don't like to tell people what to do, so I'm really trying to tell y'all what to do, but I want to give you some pointers on when you're seeking help, when you're looking for a therapist. Make sure that fit is good for you, that spirit is connecting with you, that when you sit down with them, that you feel that sense of, oh, they're going to be able to help me. They're going to be able to take me to places I didn't even think I can go. But to have somebody you and nod you on and let you go on with your foolery, that's a problem.
Mhm.
Right.
Yes.
It's a problem.
Mhm.
Definitely.
And so I was sitting up thinking about this, because we have to take full advantage. We listen, as y'all see, we have a male on the panel. Okay, a male. And so relationally, one of the things that I'm noticing in 2023 and this year is that when it comes to marriages,
Mhm.
there are a lot of husbands that has experienced trauma
Mm-hmm.
in one shape or another. Already, all the things, because Kenya, I want to say, I think you had mentioned it in your video,
Mhm.
why do men not go? And if y'all ain't seen that, y'all need to go to our YouTube channel, Talk.Therapy.Heal, because that is the $1 million question that we receive probably as therapists, period. But I know for sure in the relational realm, why do men not go to counseling? That was a question. And so with that, you have men, because one of the things you said is that, men not talking and how they were taught, you're supposed to provide and do all these things.
Mhm.
So what is a wife supposed to do? Because generally wives give ultimatums.
Mhm.
And one or two things that happen. Either the husband has expressed that he has had a traumatic experience. And I'm talking about, it could be, being in a game, watching the homies getting shot. It could be watching, dad coming in drunk, abusing mom, or mom abusing dad, because it could go both ways. It could be a number of things that the sexual abuse. That's a big thing that's under wrap and key. So lock and key. So we're saying that we know wives to say, well, if you don't go get some help and if you don't go seek a therapist, I'm leaving you. What would you say as a male? We got a male counselor, but as a male counselor, what would you share with the people?
First thing I would say is being a man comes with a lot of weight. And so for a spouse to say, go get some help or I'm leaving, that person may already feel like they're left alone anyway. So you may walk out that door. That's not helping that person overcome what they need to get over. So sometimes what you have to do, and I say this lightly, you have to kind of stroke that person's pride and their ego and build them up instead of tear them down because they've already been torn down sometimes, especially when it comes to that sexual sin that has happened where they've been molested or something of that nature. So you support them. Mandates don't do a lot of stuff because if someone has already taken something from them, now you're taking the headship from that spouse by telling them what they're going to do. But if you tell them, look, I understand you've talked to me about some of the things that have happened, baby, I'm here to support you. What would you like for me to do to make this easier for you? Would you like me to do some research? Do you want me to go with you to counseling? And that may help. Another thing I think that we have to do is we have to watch the words that we say, because sometimes men ask for help the best way that they know how, and then it gets thrown back in their face when they show emotion, like, look at you, you're crying like a punk. You just shut everything down at that point. That individual needs to be lifted up. And guess what? I know I'm a man sitting on the panel with ladies, but it happens with the ladies too. Men, we throw a whole bunch of stuff at women by telling them, oh, that happened to you in high school. That ain't me, girl. Get over that stuff. You're re-traumatizing that person over again. You are supposed to be each other's help meet. So can you guys help meet the need and get the person to the help that they need so that you guys can move on as a couple? From a relational standpoint, if one person is running 100 miles an hour going forward and someone else is running 100 miles an hour going back, where are y'all going? Absolutely nowhere. So from a relational standpoint, your relationship can't move forward until you get on the same side and move in that forward direction.
And then up in here traumatizing the baby.
Yeah, they're sitting there watching. This is exactly how I'm gonna treat my wife when I get married.
Wow. Wow. Well, let me kind of speak to this since we're still talking about trauma and dysfunction. Generally, what I see or how I kind of rationalize it, if you have trauma, unresolved trauma, it's going to probably always, more than likely than not, result in dysfunction in how you carry yourself in some type of way. And again, from a relational aspect, mostly, I'm gonna say, I'm not an expert, but mostly when it comes to marriages or just relationships, oh, we could definitely talk about this. No, not Mr. King, we're not leaving you out. But we could definitely talk about this. One of the things I've been hearing here recently is relationship of, I just can't get along with women.
Mhm.
or I want some girlfriends, or I this and this and this. Okay, but who hurt you though? Because what we do as a people is I'm taking it out on Nikki, Larisha, and Rachel, and neither one of them hurt me. It may have been the abandonment of my mother.
That's right.
So come on,
Yeah.
Jesus. Come on,
Okay.
come on,
I'm just
come on,
saying.
What
Lord.
you saying?
Look, what you saying?
Well,
Bring it
what
in.
I'm saying is, when that attachment bond has been broken from the beginning, and it happens to be, let's just say I'm a daughter, and it happens to be with the mother, that attachment, once broken, can be reestablished, can be reconnected, but if it's not dealt with, if it's not dealt with, re-traumatization occurs.
Yes. Yes.
Yes.
You see everyone as that mother, and you prepare yourself, you brace yourself for the fact that you gonna leave me because she left me.
Or you do it before they can hurt you.
Yeah.
Wow.
Yes.
Right. So
Yes.
I'm abandon my friendship. I'm gonna walk away, or I won't connect, so you won't hurt me.
Keep you at a distance.
That's good. You know, you
Oh,
can
yeah.
see that a lot in working with children when they may have been abandoned by a mother, and the mother and father may even be there, but they're not giving the attention that they need. They'll go get it everywhere else.
Yes.
Wow. I was sitting there, okay, I'm gonna pose this situation because of course what we are desiring to do, and we was talking about this before we came on, is give the examples of what it may look like. This may have happened to you. You may be doing it to your children. So for our me and my colleagues, say that there is a child and the child is always being told, oh, well, that's your aunt so-and-so, go give him a hug. Well, you shouldn't treat him like that. That's your uncle so-and-so. Okay, I see the faces. I'm feeling it, the spirit.
We
You
already
know what
know.
I'm saying? Or say this. Say there is a molester in the family. Now, this is something I don't understand. You may hear it in a different forum. Say there's a molester in the family, but the family keep that a secret. But they can sit up and talk about how, what so-and-so across the street, a neighbor, whatever the case may be. What do you all say to, let's say a child has been sexually abused? The family act like it's a big secret, so they don't want to get uncle or auntie, because I've been here lately, women too, uncle or auntie in trouble, or we don't want them to go to jail, and they just running through everybody in the family. But then the parents say, well, that's your uncle so-and-so. That's your, go give them a hug. And they're forcing them to have a relationship with that person, a hug on them, even though that person traumatized them. Can y'all speak to that, please? Yes, ma'am.
First and foremost, you are telling them that they don't matter.
Mm.
Their feelings does not matter. That how they view this person is null and void, and that you override them. And oh my God, I see it manifesting so much with kids as they become adults. You do all of these things for them or to them as children, and then you say, okay, now you're 18 or you're 21, go into the world. And they are clueless. They don't know who they are.
Wow.
And they don't know how to love, who to love,
Who to
what
trust.
to love,
Mhm.
who's supposed to love them,
Yeah.
who's supposed to be in their corner, who family is, who isn't family. Do family supposed to do that? Oh, so you mean to tell me my uncle wasn't supposed to touch me like that?
Oh, that wasn't even my uncle?
Ooh.
Oh,
Yeah.
oh,
Ooh.
oh. So then they walk around with this just overwhelming feelings or emotions of shame, guilt, all of the things. I mean, just depressed, anxiety. They don't know anything.
Yeah.
Nikki,
Oh,
you just busted that one wide open, and that goes back to your specialty. I believe that's the reason why we have a lot of issues with individuals today with their identity.
Yes.
That happened to them. Wait a minute, I was a boy and that happened to me. So now I don't know what I'm supposed to do.
Yeah. Yes.
So now I have all these feelings about men. I have these feelings about women, and they're pulling me to both sides. I'm just so confused. I'm just throwing up, and I'm going. That's just what it goes to. Yeah.
Oh my God. And I see it so much when they show up in front of my screen, and even for men as well, and they're clueless. And the one thing that I always start with in my therapeutic approach is, what is the truth about who you are?
Yes.
Wow.
And I have them do that staring in a mirror. I have so many people who just break down because they have no clue about who they are. And then when they do start to write things, I ask, Who told you that?
Yeah.
Who told you that?
Confronting it right off the bat.
Yes.
Mhm.
Who told you you were that? Well, I can remember when my mom and my dad said this, and they did this, and they told me to be. So you don't even have a clue. Now, I'm not knocking, because I am a mother, and we built our children up. When we saw things in them, we began to cultivate it, and we began to speak that over them, because what we saw their strengths to be. So we are supposed to tell our kids who they are growing up, so that they're not as clueless when they become adults going out there trying to find themselves.
Absolutely.
Right.
But when we don't help to identify them in a healthy manner, then we set them up for failure. We set them up for them to go out there and try to connect with anybody that they can. It's like, who am I? Oh my God, Larissa, can you tell me who I am? Or I'm looking to Larissa to define myself. Or I'm looking to Shan to define myself. I don't know who I am, so I'm trying to attach to anything that I think feels good.
Wow.
And you know, one thing that go ahead. No, go ahead.
No, I was just gonna say
Oh.
familiar.
Familiar? Okay. I've worked with some individuals like that. And one of the things that I did is it's kind of like a form of art therapy. I would print off colors or pages of masks from the internet. You know, the ones that people used to have up on the wall with the tears and all that stuff?
Yeah.
And what I would do is I would put them all out on the table and tell the individual, this is what I want you to do. Pick out 2 of those that you really like, and I want you to color it. One, I want you to label the way that you view yourself, and then the way that you present to the world. And you will be shocked at how much attention to detail that they would put in there. And what I generally get to show them is that, well, one, this is how you see yourself. That's usually the ugly mask. But the pretty mask is the one you present to the world. What is going on over here on this ugly mask, so to speak, that is preventing you from being actually this right here? And I have them listed out, because most of the time they won't verbalize it, but they can write it. And that's a good starting point for individuals to be able to really recognize that, hey, I'm looking at myself in a totally different manner. This trauma, this dysfunction has made me put on this mask, and that's not who I am. So how now do we transition you from this over to that?
So good.
Wow.
Yes, that is good.
Take the
And-
mask off.
Yeah.
There you go.
The
Oh,
mask
that can be
Yes.
a word right there.
Yes.
Right.
Exactly. That's one of the follow-up questions that I use with clients is, once we have identified who you are, we have, what is the truth about what you want?
Ah,
Who do
yes.
you want to be?
Mm.
Because you get to define that.
Yeah.
Right.
You know, and I think giving them permission to define themselves is sometimes like really hard for them. Like, I mean, extremely hard, because you mean to tell me I can say who I want to be?
Yeah.
Because they don't have a voice.
First, yes.
They didn't
First
have a
time they've had a
voice
voice
yet.
for the counselor.
Yes, yes. So going back to your point, Shan, when you were talking about, oh, that's your uncle, hug them, give them a hug. That's your auntie. You no longer have a voice. They're taking your voice away from you as a kid.
Absolutely.
And then when you get older, like, go out there and talk to the professional and go get a job and go to school and do this and do that. And they just is closed in and shut down as ever,
Yeah.
because they have never had their voice cultivated.
That's
Right.
it. Absolutely.
I wanted to say another thing that I could see as well, that I'm seeing is very common. And I used to participate, so I'm not one that's trying to be hypocritical, like I'm holier than thou, is that 9 times out of 10, the ones who have the most trauma and dysfunction is the ones that's always on everybody else's necks. Is what I'm saying. You always talking about everybody else. You always the one with the gallon of tea, not the cup, not the little salsa.
Yeah.
You got the whole gallon of tea.
And they lack.
And so the thing is, so I don't have to think about myself. So I don't have to. That's why a lot of people can't sit in quiet. That's why a lot of people can't sit still. That's why a lot of people is, you may start off praying, but then your mind will wander every different direction. I've got to take the roast out the oven and wait a minute, you was just talking to the Lord. You know what I'm saying? It's because I can't quiet myself. So what I'll do in order not to think about my trauma and my level of dysfunction is I'm going to keep up more dysfunction for everybody else. I'm going to make it more difficult for everyone else. I'm 50 something years old fighting people on the job. I'm fighting people at the stoplight. And so for me now, as a trained professional, because I did my work on myself too. I seen my therapist, you know what I'm saying? But as a trained professional, I can now look and recognize, wow, that's the child in you. So instead of me going off like the 5-year-old me would have did, taking it there with you, then it's either that I'm loud or I'm quiet and I'm closed off. But somewhere in there, it's like, what happened to you? That book. It's a book. It's a book.
Yeah,
Oprah
yeah.
Winfrey and I
What-
can't remember his name, but
Doctor.
Oh, he's a doctor.
Yeah.
Good. That's a good book.
it's a
Oprah.
good, it's a
That's
good book, a
Let me
great
look it
book.
up.
But what happened to you?
Mhm.
So that was one of the things that, I just wanted to kind of bring out or whatever. You either loud or you disclose, but 9 times out of 10 it's underlying trauma that is gone unresolved.
Mhm.
I'm reminded of a scripture, or not a scripture, I'm sorry, a sermon that my pastor from Illinois had preached. And I just remember the illustration that she did, our co-pastor, Patricia Phillips. She got up she had a mirror, and she said, we walk around, the mirror was facing everybody else. The mirror was facing everyone else so that you could see yourself, right?
Yeah.
And you not see, turn that mirror around
Yeah.
and face yourself.
Yeah.
And that's the thing where I say, when I have people to do that exercise, is to look at yourself when you're answering that question about the truth about who you are. And it's hard for people because I can't even look at myself. I don't like what I see.
Wow.
I don't like it. It's not pretty.
Nikki,
It's
you
not
fire
what.
high.
Yeah,
That's fire high. Yeah, that's fire high right there.
yeah. So and it's something though. But I know we have to get ready to close out. This has been an amazing. I know.
Part two.
I know. This went by so fast. It was so
This is just
amazing.
the icebreaker.
So we want to leave you all with something that you can take with you to go forward out there on your journey when you're trying to become the best version of yourself. And so for me, I want you to know that, to acknowledge that your trauma is only a part of it's a part of you, but it's a part of your history. It doesn't define you. It doesn't make you who you are today, or at least it doesn't have to. If you seek help, if you get healed and delivered from your stuff that you will confront, you can live a positive, a successful life. So just remember that your trauma, while it's a part of you, it doesn't have to define you.
I would like to say, do not continue to allow your mental health to be stunted because of the trauma and the dysfunction that you came up in. Go and get the help that you need.
Last thing I'll say is this. Just a quick quote. Don't put your makeup on without a mirror. Basically, when you're going through counseling, what you're doing is you're trying to cover up things from the past. And we're not saying you're hiding anything, but you're working towards healing. Now, imagine yourself putting that makeup on, ladies, or even men if you use it, you don't look right without that mirror. You need to take a good self-reflection to look at yourself before you start doing the work.
Good. I would just say the definition of deliverance again. Take action.
Yes.
Take action of being rescued and set free. So look at what steps can you take to be free? Like, look at your surroundings, look at what you're associated with. Don't re-traumatize yourself. It's a choice to go back to something that's not good for you. So take action.
And I would just say, cultivate your voice.
Yes.
That's really what it's about. Cultivating your voice, identifying who you are. But not only that, take that mask off.
Yes.
Wow.
Take that mask off.
Yes. So we thank you all for joining us on this episode of Talk, Therapy, and Heal. And we look forward to seeing you all again in our next up and coming episode. So before we go, we want y'all to hit that like button and subscribe, hit that notification bell.
Yes.
So you'll know that when we posted our next video. Comment, share, do all the things, and we'll see you guys next time here on Talk, Therapy, and Heal. Bye.